Chapter 10, Energy Balance, Weight Control, and Eating Disorders. This is the last 3 screencasts in Chapter 10, and the first thing that we're going to be addressing in this series of screencasts are eating disorders. But before we do that, we need to make a distinguish between disordered eating versus eating disorders. When we talk about someone that has disordered eating, the thing to keep in mind here is these are mild, short-term changes in eating patterns. They can be due to a number of things that we experience in our daily lives. It could be some type of a stressor, some type of a stressful event, an illness, a desire to modify diet on a temporary basis. Disordered eating may lead to changes in body weight and potentially nutritional problems, but rarely do they require professional attention. That is an important thing to keep in mind here, because when we start actually talking about eating disorders, these are a much more severe distortion of eating process. They very often can develop into life-threatening conditions, and the most common eating disorders that we know of, you've heard of them, are anorexia nervosa, bulimia nervosa, and binge eating disorder. So one of the things that you should be comfortable with doing is distinguishing between these common eating disorders. What do they have in common? How are they different? That's going to be especially important because many of them do share some commonalities, and you need to distinguish between them. Now, when we look at symptoms that are strictly associated with anorexia nervosa, we'll hear hair loss, bruising, fainting, fatigue, low body temperature, low metabolic rate, an intolerance to the cold, loss of heart tissue, a decreased heart rate, muscle tears, stress fractures, loss of menstrual period is very common, minimal subcutaneous fat, loss of bone mass, and lanugo. And what lanugo is this type of hair. It's a downy hair, not a coarse hair that we associate with normal individuals. If we look at symptoms of bulimia nervosa, swollen salivary glands, irritation of the esophagus, stomach ulcers, those last 2 are due to the purge aspect of bulimia nervosa. Now, symptoms of both disorders will include ionic imbalances such as potassium, which can have really detrimental consequences and can be deadly, dental decay, iron deficiency anemia, a low white blood cell count resulting in a decline in immune function, and constipation. So keep in mind that these are symptoms that we find in both anorexia nervosa and bulimia nervosa. But we really do need to distinguish between the two. Now, when we look at the prevalence and susceptibility of eating disorders, they are 6 to 10 times more common in females. That does not mean that males do not experience eating disorders. We are starting to see that on the rise. 3 to 5% of all women in North America will develop some type of anorexia nervosa or bulimia nervosa. Just think about that. That is a very, very large population. They may be more susceptible because of genetics, different types of psychological reasons such as depression, substance abuse, anxiety disorders, and quite often some physical reasons which result them to be susceptible to these eating disorders. Many eating disorders just start off with a simple diet. What happens though, the dieting may get out of control because of stress, dysfunctional family relationships, or drug abuse. Eating disorders develop 85% of the time during adolescence and early childhood. Without treatment, serious health complications can occur as a result of eating disorders. Heart conditions, kidney failure, and death. So they are really important conditions that require medical assistance and intervention. Anorexia nervosa, this is characterized by extreme weight loss, and most often, individuals that have anorexia nervosa have an incredibly distorted body image. They have this irrational, morbid fear of being obese or overweight. Anorexia nervosa is seen in 1 out of every 200 adolescent girls. They may be due to tendency to blame weight gain associated with puberty on themselves, but keep in mind, as girls go through puberty, they will have weight gain, and they need to understand that it is a natural process. Men count for about 10% of anorexia nervosa cases. They tend to be found in athletes whose sport require weight classification. They are most at risk. So example, wrestling, or if we look at low weight sports such as cross-country running, long-distance track, endurance events in particular. Two main types of anorexia nervosa exist: restricting and binge eating / purging. They have very low body weights. They have a fear of weight gain, a very distorted view of body weight and self, and they really evaluate their self-worth in terms of self-control. And if you think about it, choosing what you eat is one very, a good way to exert that self-control. No one else can do that for you. So it is something that you have control over, and that very often is a characteristic. The focus is on controlling food, eating, and weight instead of our relationships with other humans. Some characteristics are listed in Table 10-8. Now, if we look at the physical effects that are associated with anorexia nervosa, low body weight, 15% or more below what is expected. Things that will be associated will be lower body temperature and cold intolerance, loss of lean mass, a slower metabolic rate, also due to loss of lean mass, decreased heart rate, easily fatigues. This is due to damage that we see to heart muscle itself. Iron deficiency anemia. Skin tends to be rough, dry, scaly, and cold. Individuals will have a very low white blood cell count. This means that they are going to be more prone to infections, this abnormal feeling of fullness or bloating, and loss of hair. Also, we'll see something known as appearance of lanugo. This is a different type of hair. It is a very soft, downy hair, not the coarse hair that we expect to find. It's not uncommon. Individuals that have anorexia nervosa are constipated. Of special concern is going to be low potassium levels. When we look at electrolyte imbalances, the one that is most dangerous and has the most harmful consequences are going to be low potassium. And keep in mind, potassium is very much involved in the repolarization of all excitable tissue. So this can be a very, very dangerous condition. Loss of menstrual period, and this is due to the loss of fat mass. Changes in neurotransmitter function, loss of teeth, and also muscle tears and stress fractures. Now, when we look at the treatment of anorexia nervosa, it has to be done in a multidisciplinary manner. It is going to require the assistance of physicians, registered dietitians, psychologists, and other health professionals. The ideal setting for this treatment is going to be a medical center. Hospitalization is needed if weight falls below 75% of normal. The average time for recovery for someone that has anorexia nervosa is 7 years. This is a very significant condition, and sometimes we really don't understand how serious it really is. Now, when we look at nutrition therapy, the goal is to minimize or stop weight loss. You must try to raise metabolic rate back to normal, restoration of food habits, and really looking at a slow weight gain, anywhere from 2 to 3 pounds per week. It's going to require supplements with multivitamins and calcium, really trying to change an individual's health attitude towards food and make it a healthy attitude. Learning to eating behaviors based on hunger and satiety cues that are provided by our body. And if we look at other aspects, as far as psychological and related therapies, teaching the patient to accept healthy body weight. How can they regain control of their lives? How do they cope with tough situations without resulting in changing their eating patterns? And also, quite often, the entire family needs to be involved when we're talking about the overall treatment of anorexia nervosa.